Y'all know me, I'm Dr. B, and this is the buzz on Croup. Croup is a viral infection that causes swelling around the vocal cords. Officially, it's called laryngotracheobronchitis, which means it can inflame the larynx, the trachea, and the bronchi. This is usually caused by parainfluenza virus. There are a few viruses that cause this, but parainfluenza virus is the most common. We usually see it in fall or early winter, and kids usually are in their toddler years when they're affected by this. Croup follows a very specific pattern. Usually we hear that the patient went to bed completely fine and woke up around 3 a.m. making a very distinctive cough. I don't know what it is about 3 a.m. It's almost always 3 a.m. What the parents describe is that they made a cough that sounded like a barking sound or a honking sound, kind of like ooh, ooh, ooh. And when the kids breathe in after they make that ooh, ooh sound, it sounds like they're having trouble breathing. So you hear, so that cough sound is the Croup cough, and that breathing in sound we call stridor. And it can get so bad sometimes that the children will actually start to panic and breathe harder and faster, and that just scares everybody. So when parents call us in the middle of the night, very often they're saying, he's making this terrible sound, I'm going to take him to the ER. And what we usually say is, well, if he's not having too much trouble breathing, but he's just making that sound, I want you to go outside and just walk around in the cool, misty night air for 20 minutes and call me back. Or run the shower, make it very steamy, have him sitting there with you, not under the water, but in the shower, getting that steamy air, breathing it in, and call me back in 20 minutes. And usually that takes care of the problem for the first night. A lot of parents do know that if you can sit your child upright or sleep with them, kind of sleeping on you in an upright position, run a humidifier, put them in a steamy shower, usually that'll take care of it for the first night. And that's where Croup really fools us, is because the next day, the kids look a lot better. Maybe they're a little bit hoarse, but they're not making that terrible coughing sound anymore. They're not making that breathing in stridor sound. So a lot of parents think, well, we're past it. We're actually fine. The problem is the second night. The second night is a lot worse. And it can be so bad that the children will start panicking and end up in the ER. And that is one thing you definitely do not want. So the child has made it through the first night. Maybe you're thinking, things aren't so bad, but I'll go in and see Dr. B anyway. You come in, and that's where we're going to say, tonight's going to be a lot worse. So what we usually recommend, if the child had a bad night, we usually recommend is giving them a shot of a steroid called dexamethasone. And dexamethasone, fortunately for all of us, works really well on the airway, and it opens the airway up so that the second night is not as bad. It should last for at least 24 hours, so it should get them over the hump of that second night, and they shouldn't have any trouble breathing during that second night. Now, they will still cough. They'll still have maybe a sore throat or a little fever, but the breathing problem won't be there, and that's the most important thing. And then after that, over the next 2, 3, 4 days, the cough will start going away, and then by about a week, they're over it completely. The other things we'll recommend after we give your child a shot of dexamethasone is using ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug, so it can calm down some of that swelling in the airway. If you have questions about the dosing, check out episode 23 of this podcast. We talk about the dosing of ibuprofen. Do not want to use acetaminophen. You want to use ibuprofen because it works for inflammation. We'll also tell you, sleep with the child in your lap, sitting upright. Put a bunch of pillows under the child so that they can sleep upright, and run some steam or run a humidifier. That's always a good idea. Parainfluenza virus and the other viruses that cause croup are passed just like any cold virus. Dirty hands, sneezing, touching a doorknob, and then touching your face or touching your nose. So this runs rampant through daycares. And even if you go to the cleanest, most conscientious daycare, they're probably still going to get it at some point. There are epidemics of this every single year. Younger babies usually don't have a problem from this. It's usually the toddlers. And older kids and adults can get these kinds of infections, but because their airways are larger, even if they swell up a little bit, may change their voice, may lose the voice, may cause some sore throat, but it doesn't cause the breathing problems. In this case, we call it laryngitis, and we've all probably had a little bit of touch of laryngitis. You take some Motrin, you eat some ice cream, you should be fine the next day. If the child continues to have stridor after that dosing of dexamethasone, or they have trouble breathing, or drooling or trouble swallowing, or if they're appearing pale or bluish around the mouth or on the face, then what they're probably going to need to do is go to the ER. Calling 911 is what you might want to do in this situation. If they do go to the ER may order something called a soft tissue neck, which is an x-ray of the neck. And on this x-ray, you can see the steeple sign in this photo. That's what the arrow is pointing to. It looks like the top of a church steeple, and that's a sign that there's considerable swelling in the upper airway. In the ER, they may also give some oxygen or a medicine called racemic epinephrine by a nebulizer. And if they do that, there can be some rebound. The child, after the medicine wears off, it'll make them a lot better, but after it wears off, after a few hours, there may be a rebound. They may suddenly get worse. So if you do end up getting racemic epinephrine in the ER, the child's probably going to be admitted. They may do a croup tent. That's not done very often anymore. I remember when I was a kid, my mom was a nurse, and I'd have croup in the middle of the night, and I would wake up under an umbrella with a sheet over it. And it was like a steam room. She'd have a steam machine shooting in there, and it made me breathe better, but man, it was hot, and I did not like it. We don't recommend doing that at home because you have to be very careful that you don't overheat the child and dehydrate them that way. Sometimes, especially in old-fashioned hospitals, they might use a croup tent, which is sometimes beneficial for a hospitalized child. Well, that's croup in a nutshell. Now you know what to do when you hear that at 3 a.m. coming down the hallway. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.